Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. We have today an important topic, which is methyl tetrahydrofolate reductase gene mutation and pregnancy. Okay, this gene mutation and pregnancy is a matter of controversy, and there is a debate about its diagnosis, its complication, and its management. So, we are trying to discuss this gene mutation and its effect on pregnancy and what is the possible treatment. And I wanna transmit my experience about this gene mutation. I meet in some cases. One of them with a bad obstetric history. She was pregnant in early pregnancy, and she have had a recurrent miscarriage, 10 times miscarriage before, and has one living female child, followed by this repeated miscarriage 10 times. I tried to help her and do a proper antenatal care during the whole pregnancy until we reached the last month at the gestational age of 38 weeks or 39, as I remember. She was delivered by cesarean section, and she was in a very good health, and her baby was male baby, average weight, was completely healthy condition. So it was a successful. What I did with this case, I gave her heparin 5000 international unit subcutaneous once daily in the first half of pregnancy and twice daily in the second half of pregnancy till the time of delivery. The second, I give her L-methyl folate, which is the active form of folate. L-methyl folate, 1 milligram every day, oral. Also, I give her aspirin, 81 milligram per day, oral, with successful maternal and fetal outcome with this management. However, there is debate about this management as regard in MTHFR gene mutation during pregnancy. And you will see in this lecture what is this effect of this gene mutation and what is the treatment and what is the recent guidelines recommendations. Okay, let us start with the objectives. We want to know the methylene tetrahydrofolate reductase gene mutation effect and the pregnancy, the possible problems related to this gene mutation during pregnancy. What about the hyperhomocysteinemia? Testing for this gene mutation, treatment for the positive MTHFR gene mutation, a call to action. This is very important and very, very recent. And what is the recommendation of American College of Obstetrician and the Gynecologist? Is it one of the thrombophilia or not? We'll see. And lastly, the take-home message. Let us start with the debate of this gene mutation. Really, methyl tetrahydrofolate reductase is an enzyme controlled by gene. Okay, so if there is mutation in this gene, there is malfunction of this enzyme, and this enzyme is responsible for breaking down folic acid to folate. Okay, certain form of folic acid cannot be converted to the active form, L-methylfolate, okay, due to deficient enzyme or defective enzyme action due to the gene mutation. Folate in everyone is responsible for making their DNA repair, making their DNA, repairing DNA, and producing RBCs. The two common variants of MTHFR mutation are C6770 and A1298C. This is the two common variant of this gene mutation. Okay, about methylene tetrahydrofolate reductase. This enzyme, as I said, converts a form of folate called 5 and the 10 methylene tetrahydrofolate to a different form of folate called 5-methyl tetrahydrofolate. This is the primary form of folate found in blood and is necessary for multi-step process that convert the amino acid homocysteine to another amino acid methionine. Please look to this picture, please. This is the 5 and 10 methylene tetrahydrofolate. To be changed to be active form of folate, what's called the 5-methyl tetrahydrofolate, it needs this enzyme, methylene tetrahydrofolate reductase. So if the gene responsible for this enzyme is defective, there is mutation in this gene, so there is deficiency of the active form of folate, the 5-methyl tetrahydrofolate. Okay, you understand now what is the role of this enzyme. Okay, so what are the possible problems related to MTHFR mutation during pregnancy? Neural tube defect, like spina bifida, anencephaly. Also, recurrent miscarriage. You remember what I said about my case with recurrent miscarriage? So, recurrent miscarriage can happen with this gene mutation. Preeclampsia and placental abruption. Also, other health issues may happen like hypertension, glaucoma, psychiatric disorder, and even some types of cancer and other brain lesions also. Okay, so there is many health problem may happen with this gene mutation, and as I said before, there is controversy about this problem during pregnancy. Okay, and this complication and the diagnosis and the management of such a condition. Okay, homocysteine is converted to cysteine and methionine. But to be converted, it needs vitamin B12 and the B6 and the folate. And by the way, folate is a B9. Okay? Okay. Also, it needs an important enzyme, methylene tetrahydrofolate reductase, what we call it in abbreviation MTHFR, MTHFR. Okay? Okay. So, one of the most common causes of hyperhomocysteinemia is the inadequate enzyme activity of MTHFR due to genetic defect. Any causes of vitamin B12, B6, and the folate deficiency can theoretically cause elevated homocysteine. Like what? Like alcohol use, proton pump inhibitors will cause deficiency of vitamin B12, B6, and the folate. Okay, look to this picture, please. So, the body needs to change or convert certain protein to another protein, homocysteine to methionine. Okay, so homocysteine to be converted to cysteine and methionine needs two important factors: vitamin B6, B12, and folate, and methylene tetrahydrofolate reductase. And we said before, methylene tetrahydrofolate reductase change the folic acid to the active form 5-methylfolate. Okay? Okay. So, if there is deficiency or misfunction of this enzyme due to gene mutation, homocysteine cannot be changed or converted to methionine. So, homocysteine will accumulate, causing hyperhomocysteinemia. Hyperhomocysteinemia. Okay? Which may cause damage for endothelium and also causing inflammatory process and oxidative stress, may cause cerebrovascular accident, cerebral stroke, cardiovascular stroke or accident, deep venous thrombosis, preeclampsia, placental abruption, and so on. So, homocysteine, when it is increased, may cause certain pathology. And there is controversy also about this. Okay? Okay. So, hyperhomocysteinemia refers to the condition where there is greater than 15 micromole per liter of homocysteine in the blood. So, this is the top level of homocysteine in the blood, normal, the upper normal level, 15 micromole per liter. What about the prevalence of hyperhomocysteinemia? The estimated prevalence of mild hyperhomocysteinemia is 5 to 7% in the general population. Okay, as I said before, elevated homocysteine have been associated with increased cardiovascular, cerebrovascular, and thromboembolic diseases. And the elevated level of homocysteine can increase the risk of atherosclerosis by causing endothelial layer injury, promoting inflammation, and increasing oxidative stress. Hyperhomocysteinemia is found in a wide range of disease. However, the evaluation and the management of this condition remain controversial, as we mentioned before. High homocysteine level, especially with low folic acid level, can lead to pregnancy complications that include miscarriage, preeclampsia, and birth defect, like anencephaly and spinal defect. Okay, many women will have normal pregnancy even if they test positive for this gene mutation. And that's why we are saying there is controversy about this effect of MTHFR gene mutation during pregnancy and its complications. There is controversy. Okay? Because we may see patient with this gene mutation, but the pregnancy is going on very well and with very good maternal and fetal outcome. While in others, we may see some complication. Okay, what about testing for MTHFR gene mutation? Is it standard? It is not standard protocol to test every pregnant woman for the existence of mutated MTHFR gene. It can be very costly to do so, so it is expensive. And some health insurance cannot carry this cost. So it will be costly for any patient. Okay? So test for MTHFR gene mutation may be indicated in the following conditions. recurrent miscarriage, positive family history of mutated MTHFR gene, previous neural tube defect in a previous pregnancy. Baby was born before for the same woman with neural tube defect. Okay, so if I found this situation, I may ask for MTHFR test. Okay, to search for if there is variant, one of the variant gene mutation or not, as I said before. Okay, I hope it is clear enough. The two most common gene variants tested are called C6770 and the A1298C. Okay, this is the two common variants. If a woman has two of the C6770 gene variants or C6771 gene variant and one A1298C gene variant, the test often shows elevated homocysteine levels. Okay, so the woman may have, as regard gene variants, either two of C677T gene variants or one variant and the other one, like C6771 gene variant and another one A1298C gene variant. If this was found in a case, often you may see the elevated homocysteine level. What if a woman has two A1298C gene variants? The test usually is not associated with elevated homocysteine level. So which one is more dangerous? Or which one is less dangerous? Of course, if a woman has two A1298C gene variants, this is less dangerous. Okay, why? Because usually is not associated with elevated homocysteine level. Okay, I hope it is clear enough. So, what about treatment for the positive MTHFR gene mutation? Really, there is still controversy about treatment of such condition. Many studies are going on about this gene mutation. So, treatment of such a condition is still being studied. However, we can suggest treatment in certain condition, high risk, with bad obstetric history, with previous neural tube defect, with history of preeclampsia, okay, and was found to have this gene mutation. We can start with heparin or low molecular weight heparin like Lovinox, given once or twice daily subcutaneous injection, plus aspirin 81 milligram daily, plus L-methylfolate vitamin in a dose of 1 to 4 milligram daily, plus B12. Of course, as we all know now, that L-methylfolate is the active form folate. Okay, because we wanted to give the active form because the enzyme which change folic acid to folate to L-methylfolate is deficient due to gene mutation. So I'll give the woman the active form from the start. Okay, because the natural folic acid given in supplementation, the 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 sorry the folic acid given in supplementation tablet, the usual one is inactive, should be converted and delivered to the active form. But here the enzyme is deficient, which convert the folic acid to the active form L-methyl folate. So we will give the woman the active form orally, L-methyl folate, 1 to 4 milligram daily, plus B12 also. Okay? Okay. What else? We will give her anticoagulant, the form of heparin, or low molecular weight heparin like Lovenox. Also, we'll give her aspirin, 81 milligram per day. And as I said before, there is still controversy about this management in cases with MTHFR mutation. Okay, the most satisfactory results can be achieved in younger patients with MTHFR A1298C heterozygous polymorphism. So this is the better prognosis or the most satisfactory result can be achieved when the woman is young, also when the MTHFR gene mutation variant belong to the variant A1298C heterozygous polymorphism. Okay, let us see this published paper about the call to action. MTHFR polymorphism shouldn't be a part of inherited thrombophilia testing, published 2022, with many recommendations from American College of Obstetricians and Gynecologists and the other societies to not to consider MTHFR gene mutation as a part of inherited thrombophilia, and encouraging lab to remove it from inherited thrombophilia, from thrombophilia panel. Let us see. MTHFR polymorphism shouldn't be a part of inherited thrombophilia testing. MTHFR polymorphism are not an inherited thrombophilia. There is no evidence these polymorphisms are risk factor for venous or arterial thrombosis. This testing increases healthcare costs and patient anxiety. So we are cautious about this point. When you test, you are causing patient anxiety and the cost the patient because the test is expensive. And also, if you give a treatment, it will be expensive. So, multiple guidelines from professional societies like American College of Obstetricians and Gynecologists, and the American College of Medical Genetics, and the British Society of Hematology, Society of Maternal Fetal Medicine, and the Choosing Wisely initiative of the American Board of Internal Medicine. All of these organizations agree that MTHFR testing shouldn't be performed for the evaluation of thrombosis. While some laboratories have removed this test from thrombophilia panels, many still include MTHFR polymorphism in their standard thrombophilia panel. So, still some labs put MTHFR polymorphism in their labs as a one of the inherited thrombophilia. So all these organizations call to stop putting MTHFR gene mutation as a one of inherited thrombophilia. I hope it is clear enough. So that's why I said before there is still controversy about MTHFR gene mutation and its complication and its management. It is a matter of debate. Okay, what is the take-home message from this lecture today? MTHFR or gene 5-methyl tetrahydrofolate is a gene which is responsible for breaking down folic acid to folate, or the active form of folate, which is 5-methyl folate. Screening for MTHFR mutation is not recommended for every pregnant woman. Many women will have normal pregnancies even if they test positive for the gene mutation, and you should counsel any pregnant woman about that. Okay? And tell her that many women will have normal pregnancy even if they test positive for the gene mutation. So not to cause anxiety for any woman and to be relaxed. Okay? What else? MTHFR polymorphism shouldn't be a part of inherited thrombophilia testing as regard what is published by many highly respectable societies and organizations like American College of Obstetricians and Gynecologists. Test for MTHFR may be indicated if there is history of previous neural tube defect or recurrent miscarriage. Yes. Treatment for positive MTHFR gene mutation is still being studied. As I said, there is controversy about it. However, the suggested treatment may include heparin or low molecular weight heparin or aspirin and the L-methylfolate, which is the active form of folate 5-methylfolate. Okay, I hope it was clear enough for you, and thank you everybody. This is my scientific sites on Amazon. For this books belong to me. You can find it there. Textbook of obstetrics, textbook of gynecology, contraception handbook, multiple choice question book, and medical disorder in pregnancy, and the last one, gynecologic oncology. And also you can visit my website on YouTube, where you can find many lectures and many skills and many quizzes, case scenario discussion, guidelines, and so on. Go to YouTube channel, just write Alaa Mosbah, you will find my YouTube channel. Also, the other link here belong to me, is a scientific one also in blogspot.com. Thank you everybody, wishing you all the best.